Good afternoon and welcome. My name is Monica Wedlock Kilpatrick, and I serve as the Director of Connect Ministries for the National Benevolent Association of the Christian Church Disciples of Christ. As we get started, I would like to inform you that this webinar is being recorded and will be available for future viewing on the NBA website at nbacares.org/mental-health. This webinar begins our 2017 series of webinars and educational trainings to be offered by the Mental Health and Congregational Care Initiative. Today's topic is liberating the mind, how the church can think about mental health as a justice issue. Just days before we begin our 2017 Martin Luther King Jr. Day celebrations, we offered this webinar as an invitation to the church to consider how we might think about mental health as a justice issue. In this webinar, we will break down what we mean when we say justice. We'll lift up issues, common issues of justice that exist in the mental health field, and we'll discuss how the church can navigate and respond to the intersection of justice and mental health. At the end of this presentation, there will be time for questions. Throughout the webinar, we invite you to use the live chat feature by clicking on the icon at the bottom of your screen or the Q&A feature to submit any questions or to request technical assistance. If you're participating by phone, you may email your questions or requests to mkilpatrick@nbacares.org. Again, that's mkilpatrick@nbacares.org. After the presentation, we will address as many questions as possible. Again, this webinar is being recorded and will be available for future viewing on our website. So let me begin with the introduction of our speakers. Angela Whitenhill serves as the convener of the NBA Mental Health and Congregational Care Affinity Group. She's an innovative family and children's therapist, as well as a licensed minister with experience in the mental health field and higher education, and with proven success in interdisciplinary program development, bridge building, and organizational leadership. As a licensed clinical social worker, Angela specializes in trauma, suicide, depression, identity issues, and spirituality integrated psychotherapy. She formerly served as a chaplain and therapist at the Tennyson Center for Children, an NBA DHM Health and Social Service Ministry partner, and one of the Rocky Mountain region's leading residential treatment centers, where she helped create one of the nation's few spirituality integrated residential treatment programs. She's a graduate of the University of Denver and Union Theological Seminary in New York City, and holds master's degrees in the Master of Divinity and the Master of Social Work. She also has a certificate in marriage and family therapy from the Denver Family Institute, where she served as a psychotherapist at the Institute's community clinic. Welcome, Angela. Next, we have Reverend Shonda Jha, who serves as founder and director of the Oakland Peace Center, a collective of 40 organizations creating access, equity, and dignity for all in Oakland and the Bay Area. Former pastor of First Christian Church of Oakland and former director of interfaith programs at East Bay Housing Organizations, Shonda is the author of Room at the Table, The History of People of Color and the Disciples of Christ, as well as Pre-Post-Racial America, Spiritual Stories from the Front Lines, on the subject of race and spirituality in America. She serves as an anti-racism and anti-oppression trainer for Reconciliation Ministries for the Christian Church Disciples of Christ. She's a faith-rooted organizer with Interfaith Movement for Human Integrity and with the Emerging Leaders Program at the Leadership Institute at Allen Temple. Shonda is particularly proud of her podcast, Hope from the Hood, available on both iTunes and on her website, shondajha.com. She was ordained in 2005 at National City Christian Church after receiving her Master of Divinity and Master of Public Policy from the University of Chicago. Welcome, Shonda. And we also have Faye London, who defines herself as an advocate for Black women, no matter what her job title is at any given moment. She's known to say she has advocated in pulpits and lecture halls as a preacher and university-level instructor, as well as in call centers and fast food joints. In every space, her ultimate goal is to begin to change the dominant conversation around women's bodies and sexuality and the church's response to sexual trauma. Her own experience as a survivor of sexual trauma and as a Black clergywoman living with mental health issues informs her work at every level. They acknowledged a call to ministry with women in the early 2000s to dismantle silence, shame, and stigma around sexual abuse and mental illness. She's consistently done this work on the ground with churches in Tennessee before and since she earned her Master of Divinity from Vanderbilt Divinity School. In her current capacity at Sister Reach, Faith seeks to continue to broaden the conversation around women's bodies and experiences as participating fully in the image of God. At this time, I'll turn the conversation over to our presenters. Thank you all.
Hi, so I believe that I am standing in a space of somewhat facilitation, but I don't think much facilitation has to happen in the beginning of this conversation. As you've heard, we'll be hearing from three kind of specific spaces. We'll be hearing from years and years of activism around race and around understanding each other's humanity. We'll be hearing from a clinical perspective, and then we'll be hearing from a parish ministry perspective. And so at this point, I think we should just dive right in. Reverend Shonda, it is yours.
Thanks so much, Reverend Faye. So I'd like to ground us in a little bit of a prayer, just to start out, that came from Mahatma Gandhi, who many of you know was a significant influence on Dr. King. And as we honor Dr. King's legacy this weekend, I wanted to ground our conversation about justice in that prayer. Mahatma Gandhi once said, as he grounded himself in the work of justice, "Let the first act of every morning be to make the following resolve for the day. I shall not fear anyone on earth. I shall fear only God. I shall not bear ill will toward anyone. I shall not submit to injustice from anyone. I shall conquer untruth by truth, and in resisting untruth, I shall put up with all suffering." May it be true for us all. And so I'd like to use that as a way of moving into that question. What do we mean when we say justice? There are a lot of quotes about justice. There are a lot of observations about justice. There are not a lot of working definitions out there that are easily accessible. So I want to be very, very brief when I mention a really beautiful definition that Marian Wright Edelman of the Children's Defense Fund provided. And she said, "The challenge of social justice is to evoke a sense of community, that we need to make our nation a better place, just as we make it a safer place." And I believe Dr. Edelman meant that she wanted to create a better and safer place for all of God's children. And I think that's a really compelling definition of justice for us to carry into this conversation, a better and safer place for all of God's children in our communities. Now, I'm from Oakland, and Huey Newton is considered a pretty significant figure in our history, and he said, you know, I grew up hearing about justice and hearing about justice, and I kept wondering what they meant when they said justice until they put me in jail, and I looked around, and I realized, oh, they mean just us in the prisons. Huey Newton was was one of the leaders in the Black Panther Party, and so he was pointing to the racial injustice embedded within the justice system. So for me, a case study for why we need to talk about justice is racism. I'm a member of the Disciples of Christ, and when we talk about racism, the definition we're working with is race prejudice plus the misuse of power by systems and institutions. And that together is racism. And race prejudice is something that all of us deal with. All of us have breathed in the sin of protecting our own and judging people from other communities. A lot of us have been trained in bias towards people who are different from us. Race prejudice is something that is true for all people. What differentiates race prejudice from racism is institutional power. So you can hear in Huey Newton's comment about the prisons being full of just us, that notion that when race prejudice is partnered with power in institutions, that results in racism. Now, racism is definitely not the only form of injustice. The definition that we're using applies to all other isms. You can think of all sorts of other isms, from sexism to heterosexism to classism, and that same definition, gender prejudice plus institutional power, or cissexism plus misuse of institutional power, all of those isms are shaped by the combination of bias or prejudice plus power. And we live in a society where we carry with us many identities, visible or invisible. And so there's a concept known as intersectionality. And intersectionality, the fancy definition, is the interconnected nature of social categorizations such as race, class, and gender as they apply to a given individual or group, regarded as creating overlapping and interdependent systems of discrimination or disadvantage. That's particularly important for our conversation today because in the work that I do in Oakland, I've become very aware of the fact that when a Black person dealing with a mental health crisis calls the police for help, they are more likely to be seen as dangerous, more likely to be harmed or killed by the people they call for help than a white person dealing with a mental health crisis, for example. Similarly, people without English language skills are considered to be a threat, even if they are dealing with something that has nothing to do with race, when they're dealing with something like a mental health crisis. So intersectionality, I think, is an important issue for us to pay attention to because there are a multitude of justice issues and a multitude of issues regarding lack of access to power that intersect with our conversation today around mental health. For example, I want to acknowledge a thing or two in the background. Some of what intersectionality shows us is places we have privilege that's invisible to us. My light skin gives me a lot of advantages. Having a safety net because my family has financial resources is a form of privilege. Privilege is something for us to be aware of when we're engaging in the conversation about justice and mental health. And I want to share very briefly an experience I had around these kinds of intersections of issues. I've worked in housing justice for a really long time, and I believed the story that I experienced and witnessed in the street, where many of us said, isn't it tragic that because people are dealing with mental health issues, they are more prone to homelessness? They're not able to hold on to homes. Isn't it sad that there's nothing we can do about that? What should we be doing for individuals dealing with mental health issues who therefore are homeless? And we thought of it as an issue of helping individuals. Then somebody pointed out to me that before about 1982, actually there were just as many people dealing with mental health issues, but they were housed because there were federal programs making sure that they were housed and that their mental health needs were being taken care of. It was a federal policy that resulted in the reality that I have grown up with, that people with mental health issues are more prone to being homeless. I took that as a given and an issue that had to be resolved by helping lots of individuals, instead of recognizing that there were systems and an institution that had created that problem. And we are often trained to think about things individually, and there are a lot of reasons for that. It's less overwhelming. We want to make better connections individually. We are better able to create connections individually. And issues like the issue of privilege can help us think about those things. But we in the church rarely talk about the things that separate justice from charity, like systems and institutions. Those are what make injustice so entrenched, but often we don't notice how they're at work because we're trained to think about things individually. So there are a few things I want us to hold on to during this conversation. The church in Rome used to always ask a question over and over in Latin, because they were in Rome, cui bono? Who does it benefit? As we think about mental health systems, if we're bringing the issue of justice into the conversation, let's keep asking who benefits and who is harmed by the systems in place, so we can create systems that affect millions. So let's carry with us into this conversation today the issue of isms and all of the different forms of oppression that people we work with face, in addition to dealing with mental health issues. Let's pay attention to intersectionality, where those different isms intersect with each other and create a matrix of oppression that people have to overcome that might actually intersect with mental health issues. Let's pay attention to the privilege that we bring into the conversation, not so that we're ashamed of that privilege, but so that we can utilize it to support each other. And let's make sure we're paying attention to how systems and institutions benefit from things as they are, and how systems and institutions could actually serve the people they're designed to serve. Thanks.